Hello, my name is Baptista and I'm the presenter of this work, Musculoskeletal Fitness Tests for the Assessment of Pediatric Sarcopenia. This is a work done in collaboration with Dr. Vera Zimbal and Dr. Kathleen Jans. Sarcopenia is a disease characterized by age-related decreases of skeletal muscle mass and muscle strength. The clinical implications of this disease to the elderly include increased risk of falling and illness, decreased ability to perform activities of daily living, decreased cognitive ability, and reduced quality of life. It is assumed that muscle mass and muscle function in the elderly is determined by the rate of their decline during adulthood, and in this way, the modification of risk factor during adulthood, especially late adulthood, has been the main strategy for preventing sarcopenia. However, sarcopenia is not limited to the elderly. It is also present, at least in youth, with specific pediatric pathologies such as liver, kidney, or intestinal insufficiency diseases and malignancy. Clinical outcomes associated with pediatric sarcopenia include delayed growth, increased length of hospitalization, and increased rate of readmission, among others. There is also some evidence that the development of sarcopenia can begin during childhood and adolescence due to insufficient acquisition or low peak muscle mass. In this case, we are talking about apparently healthy children and young people where the concept of pediatric sarcopenia is not yet operationalized. Therefore, the aim of this study was to examine the predictive validity of musculoskeletal fitness using hand grip, the isometric plank test, and vertical jump mechanography for the identification of pediatric sarcopenia. We believe that the use of these fitness assessments to identify sarcopenia may have an advantage associated with feasibility and efficacy since musculoskeletal fitness tests are easy to implement in a scholar context, for example. For this study, the sample consisted of 140 boys and girls aged 10 to 18 years old, evaluated between September 2017 and May of 2018. Evaluation included musculoskeletal fitness, body composition, and general health status. Musculoskeletal fitness was assessed in the school, body composition were assessed in the Exercise&Health lab, and a general health questionnaire was applied to all parents at home. The musculoskeletal fitness assessment comprised the hand grip strength, the vertical jump power with a counter movement that was performed on a force platform, and the abdominal strength assessed using the plank test. The test was terminated when participants were enabled to maintain posture or their pelvis moved up or down 5 or more centimeters, measured using a ruler. The test was also ended if participants remain in the plank position for 3 minutes, in this case the highest score. Using the same cut point in adults, we use -2 standard deviations for mean age and sex to define pediatric sarcopenia. 3 indices of sarcopenia were constructed, namely lean body mass index normalized for body height, appendicular lean body mass index also normalized for body height, and also lean body mass to fat mass ratio, in this case lean body mass normalized for fat body mass. Standing gait was measured with a stadiometer with subjects in underwear and without shoes. For the statistical analysis, we analyze the ability of musculoskeletal fitness test to identify sarcopenia by using the area under the curve analysis, and also the analysis of sensitivity and specificity using the SPSS. For this purpose, all these variables were standardized using the LMS chart maker for each sex and age group. In this table, we present the description of the participants, including the mean, the standard deviation values for the musculoskeletal fitness test and sarcopenia indices. Males showed higher indices for total and appendicular lean mass than females, and also a higher lean to fat body mass ratio. Males also performed better than females on all fitness tests. Cutoff values for hand grip strength to identify sarcopenia, classification accuracy, sensitivity and specificity are presented in this table. When lean body mass index and appendicular lean body mass index were the criteria for sarcopenia, hand grip was highly accurate or moderately accurate predictor of sarcopenia. The sensitivity and specificity analysis indicated that mean 0.6 standard deviation for the identification of sarcopenia in participants of both sexes. The corresponding percentiles are the percentile 28. Using appendicular lean body mass index as the sarcopenia criterion, one standard deviation increase in hand grip corresponded to a 79% reduction in the chances of sarcopenia identification in females and 80% in males. Regarding the vertical jump power, when lean body mass index and appendicular lean body mass index were the criteria, the vertical jump power was highly accurate and also moderately accurate predictor of sarcopenia, with a sensitivity and specificity analysis indicated minus 1.1 or minus 1.2 standard deviations in males and minus 0.8 standard deviations in female for the identification of sarcopenia. The corresponding percentiles are about 17, 18, 16, about this number. In terms of odds ratio, using appendicular lean body mass as criterion for sarcopenia, one standard deviation increase in vertical jump power corresponded to a 91% reduction in the chances of sarcopenia identification in females and 96% in males. The Planck test was moderately accurate for the identification of sarcopenia only when the criterion was the lean body mass to fat body mass ratio. In this case, the sensitivity specificity analysis indicated minus 0.5 standard deviation in males and minus 1 standard deviation in females for the identification of sarcopenia. The corresponding percentiles are are in males 30, the percentile 35, and in females the percentile 18. And using the lean body mass to fat body mass criteria for sarcopenia, and one standard deviation increase in the Planck corresponded to a 79% reduction in the chances of sarcopenia identification in females and 87% in males. So, As conclusion, we can say that the hand grip strength, the vertical jump power, and the plank endurance were all valid markers for the identification of sarcopenia in children and adolescents. The accuracy of the assessment varied depending on the lean tissue criterion. Acceptable predictive capacity with 50 to 80% sensitivity and specificity in the case of hand grip and plank, and good predictive capacity with sensitivity and specificity higher than 80% for the vertical jump power. The area under the curves of the fitness test indicated moderately to highly accurate validity. Thank you for your attention.